Health news now tonight. If you have a full-time job with benefits, access to health care is probably not something you think about all the time or worry about. But a new study shows Hispanic adults in our country are 70% more likely than non-Hispanics to get diabetes. But finding resources and care sometimes very difficult. News 19's Shelly Garzone spoke with medical professionals about what health disparities the Latino community is facing. Shelly, what'd you find out today?
That's right, Andrea. Medical professionals from MUSC tell me there are illnesses people in the Latino and Hispanic community are more likely to experience, and why. Take a look.
Some of the more predominant health disparities and issues that we have in the Hispanic population, specifically in South Carolina, are obesity, diabetes, and heart disease.
Amanda Clark is a nurse practitioner with the Medical University of South Carolina.
Some of the Hispanic population can have lack of health insurance. And then just in general, we have our modifiable factors and then our non-modifiable factors. So we have things like diet, exercise, access to healthy foods, and then our non-modifiable factors, some of our genetic factors, and just some of those things that come along with ethnicity can make things a little bit harder to kind of steer yourself in the right direction.
According to the U.S. Department of Health and Human Services Office of Minority Health, Hispanic adults are 70% more likely than non-Hispanic white adults to be diagnosed with diabetes.
In Colombia and in general in the state, one of the main issues is access to care.
Miriam Torres is the Assistant Dean for Public Health Practice at the University of South Carolina. She tells me the lack of access to health care can lead to complications.
The impact is, of course, as you mentioned, health issues and late detection of conditions that, if being detected earlier, can have easier solutions.
And while exercise is something that would help, Torres says getting out to exercise might be difficult depending on where you live.
Many of the neighborhoods don't have sidewalks for you to walk. You have to take your child to school by car or use the bus, the school bus. And that makes people less active.
To combat some of these statistics, Clark recommends the following.
If we're trying to work on combating obesity and diabetes, we really want to live in a low carbohydrate, low sugar diet. Now, you don't want to be zero carbohydrates or zero sugar. That doesn't have a long-term sustainable likability for a lot of people. So you just want to start making better choices. Start using cauliflower rice instead of rice. Start focusing on your proteins or your meats and your vegetables. And when you fix your plate, try to avoid those carbohydrates or some of those saturated fats.
Well, if you're looking for medical resources in the area, there will be a health fair Saturday, September 28th at the Brooklyn Lakeview Empowerment Center in West Columbia. And MUSC also tells me they will have free health screenings on November 2nd at the St. Andrews Park in Columbia, and that will be from 10 a.m. to 2 p.m. Andrea?
All right, Shelly, thank you so much. I know that cauliflower rice is better for us, but I'll tell you what, it doesn't taste like rice. But I'll try again because of her good advice.